Welcome to the CAASN channel. Our topic for today is diet and supplements for high blood pressure. My name is Abazar Habibinia. I have an MD degree and I'm the director of the Canadian Academy of Sport Nutrition. Subscribe to the CAASN channel on YouTube to enjoy the information that we share on a regular basis about medicine, weight loss, fitness, and sport nutrition. Okay, today we are going to talk about different dietary patterns, lifestyle modifications, and supplements that can help lower blood pressure. This presentation is going to be in two parts. In part 1, we talk about dietary changes and lifestyle modifications. And in part 2, we talk about 11 supplements that can help people with high blood pressure. To create this presentation, we have used the most valid references in medicine and few articles. And you can see the list of references at the end of the presentation and also in the description of the video. For today, we have created amazing slides for you. Let's go with these slides. Diet and supplements for high blood pressure. In part 1, we're going to discuss about different diets and lifestyle modifications. I'm sure you know that high blood pressure is one of the most common diagnosis in adults in medicine in general, and it is one of the most common medical conditions for which medical doctors they are going to prescribe medications. When it comes to approach to high blood pressure, as you can see on this slide, we have medications and we have lifestyle modifications, which includes dietary and lifestyle changes, physical activity, and supplements. We will not discuss about medications. Our presentation is about lifestyle modifications. Lifestyle modifications can surely influence blood pressure both in people with high blood pressure and people without high blood pressure. Dietary changes can be helpful even to people who don't have high blood pressure. For example, if you decrease your systolic blood pressure about 2 millimeters of mercury, this is going to decrease the mortality rates from stroke by 6% and heart disease by 4%. As our age goes up, systolic blood pressure is going to go up about 0.6 millimeters of mercury. This is something in medicine we call it age-related rise in systolic blood pressure, for which dietary changes may not help. As you can see on this slide, there are 3 dietary patterns to control blood pressure: DASH diet, Mediterranean diet, and vegetarian diet. We're going to discuss all these 3 diets. The effectiveness of those 3 dietary patterns you can see on the slide. DASH diet is 2+, vegetarian diet 2+, and Mediterranean diet is 1+. That means the effectiveness of DASH diet and vegetarian diet are pretty much the same, and the effectiveness of Mediterranean diet definitely is less than DASH diet and vegetarian diet. Let's go with DASH diet first. Actually, DASH stands for, as you can see on the slide, dietary approaches to stop hypertension, which in short we call it DASH diet. The DASH diet is high in vegetables and fruits. The person is going to have 8 to 10 servings per day. This diet is high in low-fat dairy products, 2 to 3 servings per day. High in whole grains, chicken, fish, and nuts. This diet is very rich in potassium, magnesium, and calcium, also in protein and fiber. This diet definitely is low in sweets, sugar-sweetened beverages, and red meats. And this diet is low in total fat, saturated fat, and cholesterol. The DASH diet is safe and it is easy for people to follow it. 6 to 12 months studies of people with stage 1 hypertension who follow the DASH diet show that their systolic blood pressure went down 6 to 8 millimeters of mercury, and diastolic blood pressure went down 3 to 4 millimeters of mercury compared to control groups. Randomized clinical trials show that the DASH diet is the most effective one. Even though DASH diet is very effective in lowering blood pressure in people with high blood pressure, however, this diet is not recommended for people with, as you can see on the slide, advanced chronic kidney disease. Those people, they are on dialysis. Why? Because this diet is high in potassium, phosphorus, and protein. The second diet is the Mediterranean diet. It is also called the PREDIMED. This is in Spanish, Prevención con Dieta Mediterránea. Actually, there is no clear definition of the Mediterranean diet. Mediterranean diet is a general term to describe the diets consumed in several regions around the Mediterranean Sea. Here are the characteristics of the Mediterranean diet. Number one, this diet is rich in plant foods such as fruits, vegetables, breads, other forms of cereals, potatoes, beans, nuts, and seeds. Number two, fruits are the typical daily desserts in this diet. Number three, olive oil is the main source of fat in the Mediterranean diet. And also, dairy product is a part of this diet, mostly cheese and yogurt. Number five, fish and chicken in this diet, they are consumed low to moderate portions. Number six, in this diet, eggs are consumed up to 4 per week. Number seven, red meat is low in this diet. Number eight, wine, low to moderate amounts, and usually they take it with meals. And number nine, saturated fat is low in the Mediterranean diet, about 7 to 8% of basically total daily calorie, but moderate to high in total fat, ranging anywhere from about 25% to more than 40% of total daily calorie. Meta-analysis show that the Mediterranean diet can decrease both systolic and diastolic blood pressure about 2 millimeters of mercury. This diet can improve inflammatory markers. One of the most famous inflammatory markers in medicine is CRP. CRP stands for C-reactive protein. If someone has high levels of CRP in his or her blood, the person goes on a Mediterranean diet. After a while, definitely CRP is going to start going down. The third diet is vegetarian diet. A meta-analysis of 7 trials and 32 cohort studies show that vegetarian diet can lower systolic blood pressure about 6.9 millimeters of mercury and diastolic blood pressure about 4.7 millimeters of mercury compared to omnivorous diets. This is a sum up of the effects of those 3 dietary patterns on blood pressure. As you can see on this slide, DASH diet can decrease systolic blood pressure 6 to 8 mmHg and diastolic blood pressure 3 to 4 mmHg. And vegetarian diet can decrease systolic blood pressure 6.9 mmHg and diastolic blood pressure 4.7 mmHg. And the Mediterranean diet can decrease both systolic blood pressure and diastolic blood pressure 2 mmHg each. Sodium and blood pressure. It is estimated that 1.65 million deaths worldwide could be due to sodium intake more than 2 grams daily. According to guidelines from the American Heart Association and American College of Cardiology, if you decrease your sodium intake about 1 gram daily, this can lower systolic blood pressure by 3 to 4 millimeters of mercury. And here is the recommended daily sodium intake. Less than 2,300 milligrams per day for general population and less than 1,500 milligrams to people with high blood pressure, diabetes, black people, to people with a chronic kidney disease, and in general to middle-aged and elderly people. Potassium intake and blood pressure. Clinical data suggests that high potassium intake is associated with lower blood pressure. As you can see on this slide, American Society of Hypertension recommends an increase in daily potassium intake to 4.7 grams or 120 millimole per day. Actually, 4.7 grams potassium, it is the same amount of potassium that DASH diet can provide. And it is better to increase daily potassium intake through foods that they are rich in potassium. Carbohydrates and blood pressure. According to guidelines from the American Heart Association and American College of Cardiology, following low glycemic diets has no significant impact on blood pressure unless the person is diabetic. Clinical data do not support recommending fiber supplements or an increased intake of dietary fiber alone to decrease blood pressure. Alcohol intake and blood pressure. Observational studies show an association between excessive alcohol intake and higher blood pressure. The American Society of Hypertension recommends limiting alcohol consumption. How much? 2 drinks or less per day to men, 1 drink or less per day to women. Limiting alcohol intake can actually decrease systolic blood pressure 2 to 4 millimeters of mercury. And 1 drink is defined as 12 ounces of regular beer, 5 ounces of wine with alcohol 12%, and 1.5 ounces of AD proof distilled spirits. Sugar-sweetened beverages. Evidence suggests a strong association between higher intake of those beverages and higher blood pressure. Also, studies show that if you decrease basically your intake of those sugar-sweetened beverages to 1 serving daily, this can help lower blood pressure 1 to 2 millimeters of mercury. Protein intake and blood pressure. They have done many studies to see if there is a relationship between protein intake and blood pressure. Those studies have been done with both plant-based proteins and animal-based proteins. As you can see on this slide, there is an inverse relationship between plant-based protein and blood pressure, which means if your diet is high in plant-based proteins, this is going to lower blood pressure. And about animal-based proteins, in those studies, they couldn't find any basically significant impact on blood pressure. Physical activity and blood pressure. One of the lifestyle changes that can help lower blood pressure is exercise. Well, we know that for a long time that exercise has a direct effect on blood pressure. Aerobic activities of moderate to vigorous intensity, such as brisk walks for 3 to 4 times per week for about 40 minutes, can definitely reduce systolic blood pressure 4 to 9 millimeters of mercury. And those people that they have sedentary lifestyles, regardless of their ages, if they start doing some aerobic training, this is going to decrease their systolic and diastolic blood pressures by 6 to 10 millimeters of mercury. Weight loss and blood pressure. Definitely, this is another lifestyle change that people with high blood pressure should consider. Losing weight with or without restricting sodium intake has positive impact on lowering blood pressure. If you lose weight, this can help prevent high blood pressure by about 20% among those people that they are overweight, but their blood pressure is not high. And also, if you lose weight, this can help decrease the number and doses of the medications. And this is the most important part. For every 20 pounds you lose, systolic blood pressure can decrease by 5 to 20 millimeters of mercury. Cigarette smoking and blood pressure. You know, if you are a smoker and you have high blood pressure, we definitely suggest you quit smoking. If you stop smoking, this has no effect on blood pressure. However, it is mandatory for cardiovascular prevention. Okay, we are in part 2 now. In part 2, we are going to review those supplements that can help lower blood pressure. Here is the list of those 11 supplements. As you can see on this slide, we have categorized them into 3 groups, and based on their effectiveness, we have rated them by stars: 3 stars, 2 stars, and 1 star. Supplements with 3 stars are coenzyme Q10, omega-3 fatty acids, anti-ACE peptides from the fish bonito, and potassium. And 2 supplements with 2 stars are magnesium and potassium, and supplements with 1 star are arginine, taurine, vitamin C, vitamin B6, and vitamin B9 or folic acid. We're going to review quickly all these 11 supplements. Let's go with coenzyme Q10 first. About 40% of people with high blood pressure have coenzyme Q10 deficiency. Studies show that coenzyme Q10 can decrease systolic blood pressure about 11 to 17 millimeters of mercury, and diastolic blood pressure about 8 to 12 millimeters of mercury. The dose of coenzyme Q10 in people with high blood pressure is 200 to 300 milligrams per day, and it is better to take it with food. Omega-3 fatty acids. Clinical trials show that high doses of omega-3 fatty acids can reduce blood pressure in people with hypertension. However, those people that they don't have high blood pressure, if they take omega-3, what happens? Omega-3 is going to have minimal or insignificant effect on their blood pressure. And those people with high blood pressure, if they take omega-3, their systolic blood pressure is going to decrease 2.6 mmHg, and diastolic blood pressure can decrease 1.5 mmHg. And the dose should be 3 grams per day or more. Anti-ACE peptides from the fish bonito. Clinical studies show that those anti-ACE peptides that have been extracted from the fish bonito have significant effects on blood pressure. Basically, those peptides can decrease systolic blood pressure about 10 millimeters of mercury and diastolic blood pressure about 7 millimeters of mercury. Dose is 1,500 milligrams per day. Potassium. This mineral has been shown to reduce blood pressure. Doses up to 2,000 milligrams per day under the supervision of a doctor. However, potassium supplements cannot be recommended to a couple of groups of people. Those people that they are taking potassium-sparing diuretics, those people they take ACE inhibitors and the medication digoxin, and those people with chronic kidney diseases. And please keep in mind that if you are taking potassium supplements of any kind, this could aggravate acid reflux if you have it. Calcium and magnesium. Observational studies show an inverse association between magnesium and blood pressure. That means if you increase your magnesium intake, blood pressure is going to go down. These 2 minerals can lower blood pressure, even though evidence are limited. Calcium should be taken 1,000 to 1,500 milligrams per day, and magnesium anywhere between 400 to 600 milligrams per day. But the most important thing is this. The ratio of calcium to magnesium should be 2 to 1 or higher. Arginine. Arginine is a non-essential amino acid. This amino acid increases the production of nitric oxide, which is a potent vasodilator. Also, arginine improves blood flow. The dose is 4 grams per day. Taurine. Taurine is a sulfur-containing amino acid and is one of the major ingredients of bile. Taurine supplementation can lower blood pressure and improve vascular function in people with pre-hypertension. The dose is 1.5 to 3 grams per day. Vitamin C. Studies indicate that there is an association between higher vitamin C intake and lower blood pressure. Vitamin C supplementation can actually lower systolic blood pressure up to 4.5 mmHg and diastolic blood pressure 2.5 mmHg. Dose 1 to 2 grams per day. Vitamin B6 and vitamin B9. Meta-analysis of randomized controlled clinical trials show that vitamins B6 and B9 can lower systolic blood pressure. And here are the doses. Vitamin B6, 5 milligrams per kg per day, and vitamin B9, 5 milligrams or 5,000 micrograms per day. We will have a separate presentation about integrative cardiology, and in that presentation we will discuss medicinal herbs for high blood pressure. As I mentioned on the slides, we will have a separate video about integrative cardiology, medicinal herbs for high blood pressure in the future. I really hope that you learned something interesting today, because we make science easy to understand. Now you know. If you don't want to miss our next video, you can subscribe to the CAASN channel on YouTube. To support us, you can share, like, or comment on this video. Until next time, stay safe, stay connected.